Hey everyone! So let's talk about something you've probably all seen, a standard nursing school assignment. On the surface, it looks like, well, just another assignment. But what if I told you that hidden inside these instructions is actually a powerful tool? A way to literally design your entire nursing career on purpose.
And look, I get it. The first question is always, is this just busy work? Another box to check off. We've all been there. But let's try to flip that perspective. What if this isn't a chore at all? What if it's the blueprint for building the exact future you want in nursing? So here's our game plan for cracking this thing wide open. First, we're going to decode what the assignment is really asking. Then we'll dive into the three main pillars: your personal, professional, and leadership growth. After that, we'll touch on the rules of the game, and then, the best part, we'll put it all together to build your career blueprint.
All right, let's get right into it. The very first thing we need to do is change how we're looking at this. Seriously, forget about the grade for a second. This whole assignment is asking you to put on a new hat. You're not just a student, you're an architect, and you're designing your own career. You'll see it's built around these three main ideas, or pillars. And honestly, the best way to think about it is like building a house. First, you pour a rock-solid personal foundation. On top of that, you erect the professional framework, the walls and the beams. And then you top it all off with the roof, the leadership capstone that protects and defines the whole thing. Put them all together, and you've got a plan for a truly amazing career.
Okay, so we gotta start with the most important part, that personal growth piece. This really is the foundation of everything. It's all about developing those internal skills. The stuff you need not just to get by in nursing, but to actually thrive in what can be a super demanding, high-stakes world.
And the assignment is super direct about this. It doesn't just ask what you're going to do. It asks why it matters. And that why, that's the glue. That's what holds your entire foundation together and gives it strength. So let's be real. What does personal development even mean here? This isn't some fuzzy self-help talk. We're talking about a very real, very practical internal toolkit. It's the set of skills you pull out to manage crazy stress, to really connect with people through empathy, and to have the self-awareness to know when you're hitting your limit. This is the stuff that prevents burnout and keeps you in the game for the long haul. And when you look at a plan like this, you can see it's all about getting ahead of the curve. I mean, think about it. A plan for stress management isn't just writing it down. It's deciding, okay, before every tough shift, I'm doing a 2-minute mindfulness exercise. Or emotional intelligence. That's your superpower for reading a room and calming down an anxious patient. These are not soft skills, okay? These are the absolute core competencies that make you a great, resilient nurse.
All right, let's build on that foundation. Pillar number 2 is all about professional growth. If personal growth was the foundation hidden underground, this is the scaffolding. It's the visible, tangible stuff that everyone sees when they look at your career. Now, you're gonna notice the question sounds almost exactly the same, but the focus does a complete 180. We're shifting gears from the internal stuff, who you are as a person, to the external qualifications, what you actually know and what you can do. And this slide just lays it out perfectly, right? Personal growth is the who, that resilience and empathy we talked about. Professional growth is the what, your skills, your certs, your knowledge. And here's the key. You just can't have a strong external framework if you don't have a solid internal foundation holding it all up. 100%, they have to work together. So this is basically your roadmap. It's all about turning vague ideas into a real plan. We're talking about things like grad school, continuing ed, and getting those specialty certifications. It's about professional reading to stay sharp and actually joining professional organizations. The assignment is pushing you to get specific. Not just, I'll get a cert, but which certification am I going for in the next 2 years? Not just, I should join an organization, but which one am I joining this year?
And that brings us to our third and final pillar, the capstone, leadership. This is where it all comes together. This is how you design your impact. But let's get one thing straight right away. Leadership in nursing has almost nothing to do with a fancy title. It's about what you do every single day, whether you're at the bedside, in a clinic, or out in the community.
So yep, the final prompt asks you to map out your leadership development. And what this is really about is getting you to see that every single nurse is a leader. You're a leader when you're managing a patient's care plan. You're a leader when you're helping a brand new nurse find their footing. You're a leader when you advocate for a better way to do things. And you know what? The assignment actually gives us a killer definition of leadership. It's not just one thing. It's about integrating all these different roles. You're a leader, a teacher, a communicator, and a manager of care,
all rolled into one. It's about weaving all of those skills together to make sure people get awesome, high-quality healthcare. So what does that actually look like on the ground, day to day? Well, it's being crystal clear during a patient handoff, leaving no room for error. It's taking that extra 2 minutes to sit with a patient and make absolutely sure they get how to take their new meds. And it's having the courage to be the person who speaks up and says, hey, the latest research shows we might be able to do this better. Every single one of those is a powerful act of leadership. Okay, so before we put the final blueprint together, we have to talk about the rules of engagement. I know. These can look like just a bunch of annoying academic requirements, but they're not. They're actually training you in the fundamental skills of professionalism, the very things that will make your career plan work in the real world. This is your practice field. Let's just quickly break this down. The assignment says to integrate evidence. Why? Because that's not just for a paper. That's the absolute foundation of safe modern healthcare. It says engage in dialogue. Well, guess what? That's your entire day, talking with doctors, therapists, social workers, and other nurses. And communicate professionally? That's totally non-negotiable. It's all about patient safety. See? This assignment isn't just an assignment. It's a direct simulation of your professional life. And speaking of evidence, there's this little rule in there about your sources being no more than 5 years old. That's not just some random number a professor picked. It's drilling a critical habit into you. In healthcare, you have to stay current. Using the most up-to-date evidence is directly tied to keeping your patients safe. It's that simple. All right, so let's pull back and look at the big picture. We've broken down all the individual pieces. Now it's time to see how they all click together to form this complete, intentional, and really powerful blueprint for your career. And there it is, all put together. Your personal foundation. That's your why. It's the fire in your belly that keeps you going. Your professional framework. That's your what. The skills, the knowledge, the stuff you can put on a resume. And finally, your leadership capstone. That's your how. It's how you take your why and your what and turn them into a real, tangible impact on people's lives. And really, if you take one thing away from all this, let it be this. This assignment isn't a test you have to pass. It's a tool you get to use. It's a chance to stop letting your career just happen and to start being the one in the driver's seat. To intentionally design the exact nursing career you want to wake up for every day. So, I'll leave you with this to think about. Looking at your own blueprint, what's the very first brick you're going to lay? It could be personal, professional, or about leadership. But what's that first, real, tangible step you're going to take starting right now?